Some of the reasons why someone might want to see a nutritionist if they're experiencing fertility challenges range from someone who has a specific problem that would benefit from nutrition counseling, like polycystic ovary syndrome, being overweight or underweight, just looking at the overall quality of the diet to see if there's anything they could do to maybe make their body a positive place to be pregnant. Sometimes people come simply because they're confused about nutrition. They read a lot on the internet or in books, and they just want someone to run their questions by to try to find out what does the science actually say about the role of diet and lifestyle in fertility. The number one reason why I would see someone in this setting for nutrition counseling is generally for nutritional management of polycystic ovary syndrome. We know that this hormonal problem, which is the primary cause of anovulatory infertility, has a major diet and lifestyle component when it comes to managing it. But I also see a lot of people who are overweight and experiencing nutritional problems simply related to hormonal imbalances from being overweight without specifically having polycystic ovary syndrome. In addition to that, I see people who are underweight, who their lack of body fat may be potentially affecting the hormonal environment of their body, or people who are chronic dieters and they're used to really restricting their food. In that case, I'm often in the position of convincing them that you need to tell your body this is a good place to be pregnant, and that means eating enough healthy food, not just restricting the junk food. Aside from weight issues and polycystic ovary syndrome, increasingly we're becoming aware that the quality of someone's diet up to 20 weeks before ovulation, in the case of a women's health, may affect the quality of the eggs that they're ovulating. So this is the area of epigenetics. How does the environment affect someone's genetic material in their body? So we now realize that there are a lot of things that we can do to, again, try to nurture good quality egg development so that that will, hopefully in theory, assist with conception and maintaining a healthy pregnancy. When it comes to coverage for nutrition counseling, most large insurers generally will provide some sort of benefit for counseling. So it may range for someone who has a very liberal benefit where they can be seen frequently to someone who has a few visits that we need to make good use of in order to impart some good information. But it may be that someone needs a referral, and that's generally a very easy thing to get from a primary care physician because they generally understand the importance of nutritional management for their patient's health, and they often don't have the time to do it themselves. People need to check with their insurance company specifically to see what their coverage is, but more often than not, I think they will find that they do have coverage. People are often interested as to whether there are certain dietary supplements they can take to improve their fertility. So the answer to that is not as simple as it might sound. There are no individual supplements that we know will universally help a lot of people. We do know, though, it's helpful to not be deficient, for example, in vitamin D, which is a common nutritional deficiency in people. People who are trying to nurture good egg quality development may benefit from taking coenzyme Q10. Many health problems these days are related to inflammation, for which we think fish oil supplements may prove beneficial. But it's important for people to realize that there are no supplements that will compensate for a diet that's poorly balanced, for someone whose body is chronically stressed, not exercising, and not otherwise taking care of their health in positive ways. In terms of my experience in the world of fertility and diet and lifestyle management, it actually goes back over 10 years when I initially started working with patients experiencing fertility problems at a former job that I had that had a fertility clinic. I actually established a relationship with an endocrinologist there because I myself had experienced some minor fertility challenges. So in the process of she helping me to manage my health, we got to know each other, and then after my treatment with her was ended, she started to send me patients. Having gone through this experience, it gave me great appreciation for the stresses associated with fertility challenges, and also how difficult it can be for people to feel like they need to manage their diet, their exercise, their lifestyle, while absorbing so much complicated information about science and health. So in that position, I primarily was spending my time seeing women with polycystic ovary syndrome, which resulted in me ultimately writing a book on PCOS called the PCOS Diet Plan, which has been very well received, and the feedback I get is that people really, truly understand PCOS for the first time ever, having read the book, because it's very complex science. So I continue to, through social media, through presentations, blogging, and writing throughout the web, to try to promote, the importance of paying attention to diet and lifestyle, not only for management of polycystic ovary syndrome, but for just providing a good environment in your body to encourage and promote healthy pregnancy. One of the major challenges of PCOS initially is just getting a diagnosis. So historically it's been said that the average woman would see up to 5 physicians before they were actually diagnosed with PCOS, and unfortunately it often comes at a time when they're already struggling with infertility, which makes it a particularly loaded health issue. But it's really critical for women to realize that there is only so much they can do with medication to help manage PCOS. One of the major risk factors of polycystic ovary syndrome beyond the fertility journey is reducing your risk of diabetes. And studies tell us that diet and lifestyle change is twice as effective at preventing a woman with PCOS from going on to develop diabetes than simply taking a diabetes-type medication. So PCOS can be the greatest excuse in the world to finally get serious about the diet and lifestyle habits that maybe someone's tried to adopt before but haven't been successful. But to be motivated to have a baby is a great time to take advantage of that.